be speaking to you all about my paper, which is titled Autonomy, Assisted Dying, and Disability. But before I get into the arguments of my paper, I'm going to discuss the background of my paper. As many of you know, in Canada, medical assistance in dying continues to be a very controversial and highly debated issue. In 2015, the Supreme Court in Carter v. Canada struck down Canada's prohibition of euthanasia and physician-assisted death. In response, in response to the Supreme Court, the federal government passed Bill C-14, permitting people with terminal illnesses the right to request medical assistance in dying. However, the debate did not end in 2016 after the passing of Bill C-14. In March 2021, the federal government passed Bill C-7, a bill that expanded euthanasia to include people with mental illnesses and people with disabilities. Christopher Riddle is a philosophy professor who works at Utica College in New York. He supports Canada's push to legalize physician-assisted death for people with disabilities. My essay is written in response to Riddle's claim that we ought to legalize assisted dying for people with disabilities. So now that we know the background in which I'm writing my research paper, I will go ahead and discuss some of the arguments I've made in my paper. So the main goal of my paper is to show that we ought not to legalize physician-assisted death for people with disabilities. In this presentation, I hope to present two lines of argument that demonstrate why I think we ought not to legalize PAD for people with disabilities. First, I argue that the common justification for PAD or physician-assisted death, which is autonomy, is not a reasonable justification for the legalization of PAD because it forces us to offer assisted dying to people who should not receive it. Some examples include victims of racism, as well as people with asthma. I don't think I'll be referring specifically to the asthma case, but I'll be talking about the racism case. Second, I argue that even if autonomy was a good justification for the legalization of PAD for people with disabilities, legalization will result in doctors and vulnerable patients being harmed. To avoid harm, we ought to take a cautious approach and ban PAD for people with disabilities altogether. Now note that the way that doctors are harmed is going to be a little bit different from the way that patients are harmed. So I'll begin by focusing on the first argument of my paper. So the first argument of my paper is that autonomy is not a reasonable justification for providing PAD to people with disabilities. So moving on to point A, I'm going to be talking about an activist named Jamie Hale. So when you hear politicians or activists arguing against physician-assisted death, what are some of the common arguments you might expect to hear? If you're familiar with the debate surrounding the use of assisted dying in Canada, you may have heard the argument that legalizing PAD for people with disabilities disrespects and devalues people with disabilities. Why is that? Because you're assuming that their lives are not worth living when compared to able-bodied people. Note that we don't give physician-assisted death typically to able-bodied people. We give it to people who are disabled or perhaps have a terminal illness. This is what disabled activist Jamie Hale argues. In an article that he wrote for the newspaper Guardian, Jamie Hale argues that people with disabilities are often seen as financial, emotional, and practical burdens against society. This is the way Hale thinks people with disabilities are often stereotyped. If we permit the incremental loosening of assisted dying laws, he argues that the social and medical care designed to help disabled patients cope with their disability become nothing more than an expensive luxury. After all, medical care for people with disabilities is really expensive, whereas assisted dying is cheaper, usually. Because assisted dying is usually cheaper, choosing life rather than death will, according to Hill, become the wrong decision. Why? Because it's the selfish decision that burdens the family, diminishes inheritances, and potentially wastes taxpayer dollars. I think that would definitely be more relevant in Canada, where I think a lot of our healthcare is covered by taxpayer money. Understandably, Hale thinks that this is very wrong. It is wrong to pressure people to take PAD, and so we must not allow PAD to be legalized, especially for people with disabilities. Hale also argues that when we offer PAD to the disabled but deter most others from suicide, we suggest that the lives of disabled people are so poor that only they can be offered assisted dying, and that society is better off if disabled patients choose death. This potential for the devaluing of disabled patients' lives makes legalization of PAD wrong. Hale seems to think that respecting the value of a disabled person's life takes precedence over a disabled person's autonomous decision to seek assisted death. Respect, in his mind, always outweighs autonomy, according to Jamie Hale. Now, I haven't defined autonomy yet, but for now, you can just think of it as the freedom to make your own choices about your own body. I'll talk a little bit more about that later. So moving on to point B, Christopher Riddle actually has a response to Hale. He doesn't directly respond to Hale, but he does have a response to this type of objection in his paper. Riddle believes that by failing to legalize assisted dying, specifically for people with disabilities, we violate patient autonomy. By virtue of violating patient autonomy, we disrespect and devalue the lives of disabled patients. This conclusion, of course, is the reverse of Hale. So Hale says, okay, respect, that outweighs the autonomy. But Hale's like, no, you need autonomy if you want to respect disabled patients. So there's a totally reversed argument here. Riddle goes on to elaborate that failure to grant disabled patients PAD generates negative stereotypical attitudes about disabled patients. According to Riddle, enforcing a blanket ban on PAD for patients with disabilities treats disabled patients as if they cannot make their own medical decisions. Riddle argues that disabled people are people nonetheless, and they have a reasonable interest in avoiding pain. To ban them from having access to physician-assisted death is to treat them as anonymous people, people who lack personal history. It is to treat them as if their experiences don't matter. Thus, a blanket ban on PAD for people with disabilities is, in Riddle's mind, clearly wrong. So this is moving on to point C here, and this is where I decide to respond to Riddle. And this is the argument that I present in response to Riddle. So I believe that Riddle relies far too heavily on autonomy to justify legalizing PAD for the disabled. Why do I think this? Well, if Riddle believes that disabled patients should be allowed to receive PAD on the basis of respecting autonomy, it seems that he must be forced then to endorse offering PAD to all people capable of exercising autonomy. The problem with this view is that it enables people to request PAD even though their reasons for requesting PAD are problematic. For example, imagine someone named Tim, and Tim is a member of a racial minority, and Tim suffers racism in school, and he suffers racism regularly. So one day he decides he can't take it anymore, and as a result, Tim puts in a request for PAD. Would we permit Tim to receive PAD? Most people would say no. The more intuitive response, I believe, is to get Tim help and to advocate against racism in schools. We can also imagine other characters, like we can imagine a woman named Jenny who experiences misogyny in the workplace, or Adam, a man who does not have proper accessibility in his neighborhood, and thus he struggles to get around. However, for this presentation, let's just focus specifically on the racism case with Tim. If we focus on the case of racism, we realize that there is something very wrong about offering PAD to some people who are victimized by racism. Perhaps part of the reason we might be hesitant to permit PAD for people like Tim is that PAD doesn't actually fix the root cause of the problem. In other words, PAD doesn't actually address racism, which is the source of Tim's desire for PAD. In fact, PAD may very well exacerbate the problem of racism because it inadvertently targets people of color. That's another reason to avoid offering victims of racism, such as Tim, the right to seek PAD. A much better and more effective solution is to provide support for Tim and to advocate against these forms of repression, such as racism and misogyny, so that people like Tim would not request PAD in the future. However, Riddle places himself, I think, in a position where he is forced to offer Tim PAD if Tim really wants it. It would certainly be discriminatory if Riddle gave autonomy to people suffering with disabilities, but not people who suffer from racism. So I think that there is a problem of consistency with Riddle's view. So moving on to point D, Riddle actually does have a response to me. So in fact, he actually has two replies. In his first reply, Riddle anticipates the argument about offering PAD to victims of racism and misogyny. Riddle argues that autonomy is not the only value that matters whenever people perform a certain action, including physician-assisted death. To illustrate, Riddle uses the example of a person who yells fire in a crowded theater, even though there's no fire. If autonomy is all that matters, then of course we would permit this person to shout fire, since that's their autonomous choice. However, we would still think that's very wrong. Likewise, autonomy is not the only value that matters when judging the permissibility of PAD. Riddle seems to be thinking of additional values that matter to us besides autonomy. Now you might wonder, what are those values? So Riddle argues that we need three values before we can justify offering any kind of healthcare resource, including PAD, to people with disabilities. The first value, of course, is autonomy. But there are two other values. The second value is equality, and the third value is dignity. I believe he calls this the capabilities approach. And so you might be wondering, how does Riddle define these three values? So Riddle defines autonomy as the ability to make one's own choices free from government interference. Riddle believes that governments and doctors should not be so concerned with doing what is best for the patient, but giving patients the resources to do what they believe is best for themselves, under the supervision of doctors, of course. Riddle defines equality as the fair distribution of resources to all people. Under this definition of equality, Riddle argues that people should not just have access to resources, but also have the power to wield these resources to their advantage. For example, a hospital can't just give a disabled patient a medical resource, such as a wheelchair, and expect the patient to be able to use it. You need to build ramps on the buses and put elevators in buildings, so that a patient can use this medical resource to their advantage. Finally, there is dignity. Riddle defines dignity as the avoidance of prejudice, disrespect, violence, pain, and abuse inflicted against people with disabilities. Some rights guaranteed by the value of dignity include the right to make one's own choices, freedom from non-discrimination, equality of opportunity, equality between men and women, right to accessibility, and so on. As you might have noticed, values of dignity often intersect with the value of autonomy and equality. All three values, in fact, are interrelated. They're related to some extent. Now, Riddle has a second reply. This reply specifically responds to my accusation that he is forced to offer PAD to some victims of racism, misogyny, and so on. In this second reply, Riddle argues that when we offer patients PAD on the basis of autonomy, the patients have to have an irremediable condition. In other words, patients must have an ailment that can't be cured. That is why patients with a severe disability or a terminal illness would qualify for PAD, but not victims of social ills such as racism and misogyny. While racism and misogyny are certainly unacceptable, they're not irremediable. They can be cured. Because of this important distinction between social problems and disabilities, people cannot request and receive PAD simply for experiencing racism or misogyny. So in this way, Riddle hopes to absolve himself of the accusation that he must therefore offer PAD to victims of racism. He does not believe that he is forced to do that here. And finally, move on to point E, and that's where I make my final argument in response to Riddle's attempt to absolve himself of my previous accusation. So, as I said before, Riddle thinks that autonomy, equality, and dignity justify a disabled person's negative right to seek assistance in death. I don't think that these values of autonomy, equality, and dignity are enough to justify permitting PAD for patients with disabilities. I hold this view because I don't think that these values are able to precisely separate individuals who qualify for PAD from individuals who do not qualify for PAD. For example, imagine a situation in which a patient requests PAD after receiving a spinal cord injury that immobilizes the patient and inflicts the patient with chronic pain. Even though the doctor agrees that the patient's quality of life has been significantly compromised, the doctor refuses to grant the patient's PAD request, because the doctor thinks that the patient can live a reasonably good life with the right medication, therapy, and lifestyle changes. In this scenario, in which both sides, the patient and the doctor, can make a compelling argument for their opposing viewpoints, who ends up getting their way? On one hand, we see a doctor appealing to the value of dignity in order to show that this patient ought not to receive PAD. On the other hand, you have a patient relying primarily on autonomy to argue that he ought to receive PAD. This is the type of situation that I'm very worried about. If we legalize PAD for people with disabilities, difficult scenarios like the hypothetical one I just described will occur. And as a result of the law's ambiguity, mistakes will be made in which patients will be given PAD who should never have been offered PAD. The Superior Court case in Quebec that forced the government to expand physician-assisted death, I believe the name of the case is Truchen, acknowledged that errors will be made. And as a result of these errors, unqualified innocent people will die. Because innocent people will die as a result of legalization, the government ought to maintain, in my view, a cautious approach and avoid legalization for people with disabilities. Now, there are, again, a number of objections that Riddle can raise here. I unfortunately can't address all of them. I can imagine Riddle developing one objection. Riddle could argue, for example, that we allow doctors to perform risky surgeries with the consent of the patient all the time. There is always a possibility that the physician will do something wrong that will result in an innocent person's death. However, we don't ban risky surgeries. Riddle actually discusses this objection in his article. He uses the example of emergency room departments. He points out that in Canada, seniors who go to the emergency rooms have a much higher risk of getting a respiratory or gastrointestinal infection. Yet, we don't abandon the use of emergency rooms for seniors. Now, I argue in response to Riddle that the primary goal of surgeries or emergency rooms is to protect life and improve life. Their purpose isn't to harm life or take it away. Since surgeries and emergency rooms generally succeed in protecting life rather than harming it, we permit them even though there remains a risk an innocent person could be harmed or killed. Unlike surgeries and emergency rooms, PAD guarantees death, and thus I distinguish it from PAD. Now, at this point, I have to leave this argument alone now in order to address my second argument. However, take note that I'm making a very important assumption here. I'm assuming that preventing wrongful death of a disabled person is significantly more important than protecting a disabled person's negative right to seek PAD. In other words, I'm assuming that the consequences of ignoring a legitimate request for PAD is less worse than ignoring the moral consequences of a wrongful death. And so if you'd like to ask me about that during the Q&A, please do. So now I'm going to move on to argument two. If you remember what argument two is even if autonomy was an acceptable justification for PAD, legalization of PAD will result in disabled patients and also doctors being harmed. So Daniel Callahan offers, in my view, a useful argument against Riddle's advocacy for PAD for people with disabilities. In this argument, Callahan grants Riddle's premise that people with disabilities may request PAD on the basis of autonomy. Callahan argues, however, that there are serious moral consequences if we legalize PAD. According to Callahan, PAD is not a private matter in which a patient alone autonomously decides what to do with his or her body. PAD also requires the assistance of physicians who are autonomous and responsible moral agents. They're not mindless lab coats who walk around just doing what they're told. Since the doctor is also a moral agent, the doctor must have an independent moral ground then to justify offering PAD to a patient. However, what are these independent moral grounds? Perhaps the doctor will think that the patient must experience X amount of pain before the patient can receive PAD. But how would the physician reliably assess pain? Imagine, for example, a scenario where 3 patients visit a doctor with the exact same disability, but only one patient tells their doctor that their suffering is unbearable. Should the doctor provide just the one patient PAD and not the others? Some doctors would have reason to think that they should be skeptical about offering this one patient PAD. In fact, Callahan has actually spoken to many doctors at euthanasia conferences where they admitted to him there is no objective way to measure or judge suffering. Callahan mentioned this in 1992. Even today, doctors still struggle with the same problem of measuring patients' pain. Dr. Jianren Mao, who works for the Division of Pain Medicine at Massachusetts General Hospital, argues that people have a difficult time articulating their pain with just numbers, and thus are more likely to be misdiagnosed, end quote. Since doctors struggle to objectively assess pain, it seems difficult then for doctors to morally justify their decision to offer any of their disabled patients PAD. And now moving on to point B. Authors David Pina Guzman and Joel Michael Reynolds give us another reason to believe that legalizing PAD for people with disabilities is not a good idea. Pena Guzman and Reynolds argue that doctors often struggle to communicate with their patients, resulting in a misdiagnosis. Of course, the possibility of a misdiagnosis is not, by itself, a serious reason to ban PAD for people with disabilities. A misdiagnosis is a very real possibility for several life-altering medical procedures. However, Pena Guzman and Reynolds cite a 2015 and a 2017 study, which shows that doctors are more vulnerable to communication failure when dealing with patients with disabilities. The authors also cite a 1997 study to show that people with disabilities are more likely to be misdiagnosed than non-disabled patients. The authors go on to mention a few examples of patients who are more likely to be misdiagnosed or underdiagnosed, such as people with cognitive impairments, cerebral palsy, and spinal cord injuries. To explain the increased likelihood for miscommunication and misdiagnosis, the authors develop a few theories that explain why this occurs. For example, the authors argue that doctors prejudicially downgrade the credibility of a disabled person's testimony. The authors also think that since patients are disabled, doctors wrongly assume that disabled patients lack the capacity to reason, and as a result, doctors place less trust in the testimony of their disabled patients. The authors also theorize that doctors sometimes get a bit overconfident about their knowledge of the disabled patient's situation and thus become vulnerable to making mistakes. According to a 2001 study, Pena Guzman and Reynolds point out that medical experts often have an inaccurate perception of the quality of life of disabled people. The authors make this argument because doctors systematically rate the quality of life of disabled people much lower than the average non-disabled person does. Because doctors rely on this very inaccurate medical model about people with disabilities, doctors approach treating people with disabilities with a fundamentally flawed perception of them. And this is very important because if they already have a very low view of a disabled person's life, they don't think it's that valuable, naturally you can understand why legalizing physician-assisted death would be a problem, because it seems then that doctors will encourage patients to seek physician-assisted death when that's not actually needed. While Pena Guzman and Reynolds don't object to Riddle's argument that we should legalize PAD for people with disabilities, they do raise an issue that adds an additional challenge to Riddle. Since we know that people with disabilities are more vulnerable to misdiagnosis, Riddle needs to show that this phenomenon will not be the case if PAD is legalized. If Riddle cannot show that we can reasonably prevent this phenomenon, this gives us a strong reason to object to the legalization of PAD. So now I'm going to move on to my conclusion now. In this presentation, I presented two arguments against Riddle's view that PAD should be legalized for people with disabilities. First, I presented an argument that shows that Riddle's framework for legalizing PAD is not as consistent as it should be. His values of autonomy, dignity, and equality are not, in my view, good enough to justify PAD. Secondly, I presented an argument that attempts to show that even if we could legalize PAD on the basis of autonomy, doctors would inevitably be expected to carry out moral decisions that they're not capable of making. Also, disabled patients will likely be placed in situations that increase the risk of medical harm. For these reasons, I argue that we ought to be skeptical about the permissibility of PAD for people with disabilities. So that marks the end of my presentation. So thanks so much for listening.